Great. Yeah. So, appreciate everybody joining us here for part 2 of what we had started a couple of weeks ago, talking about anxiety, depression, brain inflammation, how those things all integrate together. It's a big topic, super important, lots of things. But right before I started recording this, Dr. Mike was starting to mention how, some of these other little videos that I'm going to be posting up onto our YouTube channel here soon will really tie into some of what we're talking about, and even some of the other services that Dr. Mike is bringing into the clinic. For those of you who are local, who happen to be watching this, some exciting things that are going to be coming in as I shift around our limited square footage at this existing location. Dr. Mike and I were brainstorming that here today with Denise, the office manager, and kind of have, I think, a tentative game plan to make it work in our space while we still look for, a bigger space as we are growing as a clinic. For those of you who don't know or didn't see on our social media, we also have another chiropractor who's going to be joining us starting in July for essentially like their residency, what we do in chiropractic. So he'll be kind of working, shadowing alongside me for a few months. And then in October, end of September, beginning of October, he'll be beginning his own true practice at that point as he gets licensed on his own. But one fun thing about him is that he has already done his neurology diplomate in chiropractic neurology, and so he's done hundreds of hours specific to neurology, above and beyond what we get in chiropractic school. So guy's a little ambitious, but he's eligible to sit for his neurodiplomate test as soon as he graduates. And so when it comes to functional neurology work, we'll have another brain on board, our team here, to be able to really lend an extra eye and set of neurons and glial cells, as we'll get into here tonight, on brain inflammation and neurological disorders. So that's an exciting thing that's going to be coming up. Doc, do you want to mention again a couple of the things that you're maybe expanding into?
Yeah, actually, it sounds like maybe Rich should have been a guest lecturer tonight rather than you and I. But Ashley can pick up the slack then. That's fine. So, no, actually, we talked a little bit because as we go through our discussion today with brain health, some of the new exciting things that we're going to be bringing to the Wellness Center, the clinic, is number one, expanding age group. So we'll be going down into the pediatric realm, not all the way to newborns, but we're going to take it all the way down to 2 years of age. And that's something that I've done for, I'm not going to tell you how many years. That would be embarrassing, but you get to, just a couple of years. But, it's kind of fun to be able to tie in, as my background is, as you know, family medicine. So much of family medicine is cross-generational, and so much of family history plays into it, not to mention social dynamics of what is in the family dynamic, etc. So being able to do the pediatrics, so not birth to death, but certainly from the pediatric into the adolescent, adult, young older adult. And then the other big thing is, and you may have seen it on our posting, we did a seminar, and the team is working on starting up with some IV therapy, so some actual intravenous infusions in the clinic, in particular things just along the lines. We'll talk, I'm sure, at some point about IV glutathione, glutathione being such a potent antioxidant. So many good things that can be said about it. And yeah, you can supplement it. Kevin knows, with liposomal glutathione, you can supplement it orally, but it is certainly much better in the intravenous form. As with any medicine, quite honestly, you bypass the liver effect and what they call the first pass effect. So anything intravenously is going to be more effective for you. But IV therapies is also an exciting thing, and especially after everything that we've been through with COVID, etc. But more importantly, as we get back into really back into normal life, to daily life. I don't say normal life. Let's say daily life. Let's say that taking care of all the things that have been put on a shelf, and that's where the IV therapies can kind of come in there and help us out with.
Yeah, no, that's definitely an exciting thing for sure. Um, I don't know, Doc, if you want to start off here tonight, but for those who missed part one, we started kind of a high level view of depression, anxiety, brain inflammation, or neuroinflammation, and what that does. But I know there's a lot of confusion about meds and about some of these other neurotransmitters and things that can be done. Dr. Ash and I are both going to talk about a number of different pieces, really getting into brain inflammation. So I don't know if you want to start off, if you want to end, how do you want to play this?
Why don't I try and do it at the end, because I think what you guys are going to talk about is actually more exciting. When it comes to medications, the one thing that you've heard me say, and other people have heard me say, the less medicine, the better. Anytime you can kind of work on things without medication, then it's a good thing. Medicines are certainly something that are necessary for a lot of people. But as I tell a lot of my patients, these are controlled poisons. These are things that are trying to change what's going on inside your body. And sometimes it's actually necessary in order to support what should be doing its own thing normally, a homeostasis. We can use medications to bring that back up to a homeostatic thing, but a homeostatic level, but we still need to work on everything else that caused the alteration in the first place. And that's where I think when you talk about brain inflammation and diet and sunlight, vitamin D, I mean, I think it's better if we talk about that. When I see patients, we will talk about why one medication might be better for another one, because it really has a lot to do with which neurotransmitter might be at the base. And as we talked last week, there's a bunch of them. We talked about norepinephrine, what they call the monoamines, the norepinephrine, the serotonin, the dopamine as excitatory neurotransmitters. There's also acetylcholine, which has a lot to do with learning and memory, and then also GABA, which is one of the inhibitory ones. So how they all interplay is where we have to kind of think about with medications. But talking more about sort of those roots is where we would go from here. But we can certainly talk about them, because I know everybody's been exposed to them, and some really interesting things that tie in. Some of the studies with escitalopram, which is Lexapro. It has a direct effect to the receptor that has to do with interleukin. And I know you're going to talk about interleukins tonight. So why don't I shut up and you guys talk a little bit about those exciting things, and then maybe I can tie in how some of those medicines can fill those gaps.
All right, cool. That works. I think that makes sense. So, one thing to keep in mind when we talk about brain inflammation or neuroinflammation, we're not talking about pain. There's not pain with neuroinflammation. And so how does that present into the clinic? Well, it's not the person talking about having headaches, having migraines. So how does it present? It's the depression, it's the anxiety, it's the inability to concentrate and focus, that consistent brain fog or mental sluggishness, a lack of endurance and consistent fatigue for activities that they might have been doing before, and not frankly even wanting to get out of bed and move on with the day. So please keep in mind, when I say neuroinflammation, I'm not talking about, man, my brain hurts. It's not what we're feeling, okay? We're not talking about the nociceptive, pain-producing qualities in the brain, because that's not really there. This is inflammation that's changing function of the brain, okay? One thing that we need to keep in mind as well is that a lot of people think of brain cells as neurons. Okay, they think, oh, neurons equals brain cells equals what our whole brain is made up of. And the reality is only about 10% of the cells in our brain are neurons. So what are the other 90%? These are things called glial cells. Glia in Latin means glue. For a long time, people really didn't think there was much of a function besides for a bunch of goo that was holding all the neurons together into one, orb that sits inside of our head. Reality is that there's a distinct function to these things, and they are critically important, as you're going to hear a lot about. Okay, a lot of the function of these glial cells is for inhibitory functions of the brain. The neurons, that 10%, are producing a lot of the effects that our brain has. However, the glial cells are functioning in a large way to inhibit what those neurons are doing, to keep them in check in some ways. So, an example of this, that 8-year-old child who has been potty trained for 5 years and hasn't peed the bed for 5 years, who all of a sudden starts having bedwetting, you might want to question what's happening with their glial cells and their ability to inhibit the 10% functionality, or the 10% of cells in the brain called the neurons. Is that working well? The person who has uncontrolled outbursts or of their emotions, moods, behaviors, how well is their glial cells able to regulate and inhibit some of those neuronal impulses? Okay, so these glial cells have a key role in brain function, but everybody has been focused for a really long time on just the neurons, those 10% of cells. They are really important, by the way. Those neurons are important, but I want to focus on the 90% right now here tonight, largely, okay? There's different kinds of glial cells. There's astrocytes, there's oligodendrocytes, and there's microglial cells. I'm not going to come back and quiz everybody, but these things are all important because they all have different roles and functions, once again. So let's talk a little bit about them. Oligodendrocytes, okay? These are the cells that are really providing the myelin sheath around neurons. Myelin, if anybody recalls, is think of it as the insulation around some of the neurons that allow those cells to conduct their signals appropriately. Where's an example clinically where we see this being a problem? Kind of the classic that comes to most people's mind is MS. It's a demyelinating disease. The myelin sheath is being destroyed on these neurons, which creates a lot of neurological problems for the person who is afflicted by that. So oligodendrocytes, these are the cells that are providing that. They're a type of glial cells. Astrocytes, I'm going to talk about next. They're probably the least understood of the glial cells, but they're really important for synapses. When two neurons are coming together, there's a gap between them called the neuronal cleft, okay? And that's where the neurotransmitters are functioning, all the chemicals in our brain. That's where they're having an impact, is in that neuronal cleft, okay? And the synapse is that kind of connection point between those neurons. So these astrocytes are critical for helping to control neurotransmitters between the neurons. They're also helpful for releasing different neuronal growth factors that respond to cases of injury to the brain. One big thing for them is that they are critical for helping to sustain and support the blood-brain barrier, or that membrane that is kind of protecting the brain and the different neuronal structures from the outside environment, okay? These astrocytes are also helpful for getting glucose, oxygen, some of those other nutrients that are critical for nerve function into the brain, okay? Little fun fact for you, Einstein, when he died, his brain was studied and looked at, and everybody thought for sure, this genius, his brain was going to be so much different than everybody else's. Guess what? It was the same size. It was the same volume, same everything else. One distinct difference, though. The number of astrocytes that he had compared to a, quote, normal brain was exponentially higher, like quantitatively higher. And so astrocytes may or may not have a pretty important role in IQ and how intelligent you are. Okay, and so a little fun fact for you. When it comes up on Jeopardy, Einstein from astrocytes, all right? You'll thank me later. Remember me. And then the last kind of glial cells that I want to talk about are the microglia. And Ash is going to talk a lot about these, but I'm going to kind of give a highlight of them. These are similar to the macrophages, which are part of your immune system. So think of this as kind of like your immune system's representative in the brain, okay? They help to fight infections, but they also respond to injury and release different chemicals to help support neurons. But some of those chemicals can also be damaging to neurons in the brain as well, okay? One of the key features of all of these kinds of glial cells as a whole is that they provide for what's called synaptic pruning. Those synapses, neurons are constantly trying to connect and form with other ones. That's that neuroplasticity that people might hear about, your brain's ability to form new connections and new pathways. That's frankly how you learn something. And it's like, oh, it's just like riding a bike. Well, why is riding a bike easy if you haven't picked up a bike in 15 years? Because there's pathways that have been ingrained in your brain, and your brain knows what and how to do that because those synapses have been formed and connected. And so these glial cells are important for synaptic pruning because sometimes those neurons are trying to connect and form other pathways that frankly aren't appropriate, aren't efficient, aren't effective in any way. And they're going through and trying to clean all that mess up and make sure that we're only forming pathways that should be made and maintained, okay? The one piece with that, though, is that can only happen if glial cells are in what's called a steady state. Ash is going to explain all of that, so don't worry about that now. I will mention this before I keep droning on here. If you guys have questions as I'm going along, please put them in the comment bar so we can answer them as we go along or as at the end here so we can be sure to do that. So don't let them stew and then forget them at the end. Plug them in now so we remember, all right? So they're important for this synaptic pruning. These glial cells can only do that when they're steady, kind of at ease state, okay? If a glial cell gets primed, which Dr. Ash is going to talk a lot about here, they stay that way forever, and their ability to do their jobs forever changes, okay? That should be a pretty sobering and frankly scary statement to anybody who's listening right now, okay? If your brain changes, these cells, which are 90% of the brain, may be changed forever, okay? So how do we see this clinically? Why does a child get autism? Might be a really important question, because guess what we see on autistic children's brains? Massive amounts of brain inflammation. Why does that third concussion that somebody received matters, even if it's a minor one? Why does the first concussion matter? Because these kinds of changes can last forever if they're not dealt with appropriately, okay? One thing to keep in mind, when I talked about the astrocytes, about 15% of your brain is made of these astrocytes, one of those kinds of glial cells. If you lose one because of inflammation, do you ever get it back? Not with these ones. You know, you have a liver cell that dies, your body's going to regenerate that. If you lose an astrocyte, it's gone forever. There's no cell division. What you lose, you lose. What does that do? That decreases the oxygen delivery to the brain. It decreases glucose, the fuel supply to the brain. It decreases and compromises blood-brain barrier function, okay? You can see this on MRIs. If somebody gets a brain volume, and they are looking at that on an MRI, you can see quantitative changes in brain volume, and that can largely be due to this cellular loss that can occur due to brain inflammation, trauma, etc. Okay? Now, some of you might be sitting here and saying, wait, I've heard some of that new exciting research. There's neurogenesis, which we didn't think there was for a long time. We knew about the neuroplasticity. We're going to make new connections. But neurogenesis, we can actually make new brain cells now because of some of the stem cells that happen to be present in the brain. Absolutely true. Here's the problem. Clinically, functionally, it's not enough to make any difference at all. If you've had significant loss of these cells, any neurogenic changes that you might have, there is no literature and no evidence clinically to see any marked change in somebody's function. So for sake of everything we're talking about here tonight, if you lose the cell, it's gone, unlike pretty much any other cell in your body, okay? So what happens with traumas, like a traumatic brain injury, a concussion? What happens with a chemical or a pathogen that happens to be impacting the brain? What about blood-brain barrier breakdown that happens because of gluten exposure in the gut that happens to be transversing up the vagal nerve and then impacting the blood-brain barrier? Other food compounds that our immune system might be reacting to. Our glial cells become primed. As I mentioned before, they change structure, they change function, and they're no longer scavenging or helping to clean up our brain. And I'm going to let you talk a lot more about these glial cells and kind of what they're doing and why on earth these microglial cells are having a significant impact on that brain inflammatory pathways.
So as Kevin said, in homeostasis, these microglial cells are patrolling the brain, cleaning up debris. This is what we call phagocytosis. Again, like he said, kind of like immune cells. They're messengers looking for things to clean up. They release different neurotropic factors that, like Kev said, increase neuroplasticity, these positive changes that we want in the brain. They modulate the neurons. The pruning, think about pruning a tree. You prune tree for better function, better fruit. They prune the synapses, again, for, better function. They fight infections. They get rid of plaques. So those are all functions of these glial cells where they're in a homeostasis, okay? Now, they kind of look like we don't have, I'm going to be the microglia. It has all these arms and branches coming off of the cell. So that's what we want. Those branches are, they're pruning, they're, taking care of debris. That is the physical shape that we want. So there's various functional states of these microglia, M0, M2, and M0, M1, M2. So you're going to hear me talk about these different functional states, if you will, or pathways. So M0 is that homeostasis, that steady state. It also is kind of known in the world of neurology as a steady resting state. However, they're not resting. They are doing their thing, pruning, cleaning up debris, whatnot. M1 is the pro-inflammatory state. You might guess this is not the state that we want these microglia to be in. And then M2 is the anti-inflammatory state. So M0, M1, M2. M1, like I said, is the pro-inflammatory state. There are various inflammatory cytokines that are upregulated when microglia are in this state. So you've heard us talk about cytokines. Again, they can be pro-inflammatory or anti-inflammatory. But again, we see these pro-inflammatory cytokines in the M1 state. So interleukin 6, interleukin 12, interleukin 23, TNF alpha, INOS. These are all pro-inflammatory cytokines. And this M1 state is associated with pathogen elimination and tissue damage and just overall neuroinflammation. So then the M2 state is the anti-inflammatory state. So there's anti-inflammatory cytokines like IGF-1, there's BDNF, brain-derived neurotropic factor, and other growth factors that we want to be expressing in the brain. Now, this is, again, you know, associated with the resolution of inflammation and kind of going back to this state of homeostasis that we want. Now, microglia should kind of go like ebb and flow through these states, you know, fairly easily and, you know, from time to time, but they shouldn't stay in especially the M1 state. So the M1 state is kind of normal for the microglia to do, but they should not stay there. The problem is when the microglia become primed, as Kevin alluded to. So this is when the microglial cells have a trauma, have an event happen that causes them to change structure. So like I kind of went like this and I had all these arms coming off of me. That, again, is the branch state. But when we see that change in structure, they just kind of don't have the branches anymore. So they're not doing their functions and they are more of a sphere.
Think of the normal cell shape that you guys learned about in 6th grade biology when the teacher drew a cell and it was just a blob with a cell. Like that's what a primed microglial cell looks like. It doesn't have all the branches coming off of it anymore.
Yeah, so this is really the microglia become overactive and overzealous. Okay, so they're kind of like doing a cool steady, doing their functions in a steady state, and now they are overzealous, overactive, completely have changed their shape, and when they are primed, they do not go back. Now, again, there's a trauma. So we mentioned traumatic brain injury and infection, even lipopolysaccharides, which is a byproduct of gram-negative bacteria. If you have a leaky gut, this can upregulate. People, a gluten exposure for a certain sensitive individual, binging on alcohol can even prime glial cells. There's many different things that can prime glial cells, but those are some of the main ones. I thought you were going to say something. So again, when we have, and this can manifest in a lot of different symptoms, but the root is this chronic neuroinflammatory state. So even though we have these primed glial cells, we still want to be able to foster an upregulation of the M2 anti-inflammatory pathway and a downregulation of the pro-inflammatory M1 pathway. So hopefully you guys are still with me and that's making sense.
There's a lot of big words in this.
But really it comes down to pro-inflammatory, anti-inflammatory. So there's many different lifestyle factors that, like I said, can upregulate the M2 anti-inflammatory pathway and downregulate the pro-inflammatory M1 pathway. So I mentioned alcohol. So people will say, I've never been the same since I had that one alcohol binge. So their glial cells became primed. But we just need to know from a brain standpoint that alcohol consumption causes neuroinflammation. The brain, especially the cerebellum, is very sensitive to alcohol. And again, so when we're consuming alcohol, we're increasing inflammation, increasing oxidative stress within the brain, and upregulating that M1 pathway. So if brain health is a concern, and if you have significant brain-based symptoms, alcohol intake is something to be mindful of. Probably one of the most important lifestyle factors would be exercise. So especially high intensity interval training, and the research, it shows really, again, upregulates that M2 pathway within the microglial cells. And I think it's important to also say that, you can overtrain and you can undertrain, and both the overtraining and the undertraining are going to be sources of neuroinflammation. So finding that sweet spot where there's obviously other pieces and of exercise that fit in that sweet spot, but high intensity interval training is especially helpful for the brain, anti-inflammatory. It increases that BDNF for plasticity and opioid effects and whatnot. So again, if you have brain-based symptoms, consider high intensity interval training, and especially consider, are you overtraining or undertraining, because both ends of that spectrum are really going to contribute to the neuroinflammation in the brain. Stress. Stress comes up in every one of these videos. But again, stress is inflammatory. So, we have lots of different resources on the blog and whatnot. But one thing that I want to point your attention to is a YouTube video that Kev did recently about alternate nostril breathing, and it's on YouTube. Yes, on our YouTube channel, on just the beneficial effects on the autonomic nervous system. So we've got the parasympathetic and the sympathetic portions of the autonomic nervous system. And when we are dealing with stress, the stress state is typically that fight or flight, the sympathetic nervous system. And so when we're under stress, we really want to try to foster a parasympathetic, a rest and digest state. So alternate nostril breathing is a really great way to really quickly shift into that parasympathetic, helps really tone the vagus nerve, which is the wandering nerve that goes from our brainstem to our gut as part of the enteric nervous system, that is really the communication between our gut and our brain. And when we're doing deep belly breaths or this alternate nostril breathing, we are really helping to activate the vagal nerve and activate that parasympathetic response that we want, that is going to have anti-inflammatory effects systemically, but also within the brain. Obviously, deep breathing, there's many different things that you can do, but wanted to draw your attention to that alternate nostril breathing and just the awareness of the vagus nerve and the parasympathetic response in regards to neuroinflammation. I
want to point out, I'm going to give a little plug for a book that I recently read while I was on vacation. It's called Breath.
Oh, yeah.
I think the New Science of a Lost Art, or it's a subtitle, something like that. Mm-hmm. It just came out a couple months ago, and it's a great book talking about the power of breathing to regulate nervous system function, and it's pretty fascinating. Some of the research and everything that has gone into it, and breathing and breath work. It sounds really hokey to a lot of us in the Western world, but it has been used literally for thousands of years to create truly incredible physiological changes for the body. So if you're interested, or you're like, what the heck does breathing have to do with anything? Listen to Audible, the book Breath. I think it's like 7 hours long on Audible, but it's a great book talking about that, and certainly wets your whistle a little bit to how important that can be for true health and wellness as a whole. It's almost a pillar of health that people don't talk about at all.
Yeah, so true. So again, another lifestyle aspect that is foundational to brain health is sleep. You really can't have a proper functioning brain without adequate and deep restorative sleep. I heard a statistic recently that, disrupted sleep just for one night has ramifications for at least 4 days after. So hugely important when we're talking about the brain. Again, loss of sleep just is going to activate the microglia and make them angry and inflammatory and upregulate that M1 response. So deep restorative sleep, and kind of closely linked with that is blood sugar. So some people can have disrupted sleep if they have a dysglycemia presentation, if their brain doesn't have proper glucose or ketones to get them through the night. So again, blood sugar, we talk about this a lot. You need to have proper blood sugar handling and regulation for, again, systemic effects. If you want to have anti-inflammatory effects within the brain and the body, we need to keep blood sugar stable. And then closely related to this then would be considering a ketogenic diet. So when the body shifts from a sugar burning state to a fat burning state in a ketogenic style diet, the brain is so happy. The brain actually doesn't function super well in burning sugar. Fat is the preferred fuel source for the brain. So we want to consider, especially from a neuroinflammatory standpoint, ketogenic diets that can be hugely therapeutic. And I think, Mike, you might be talking more about that, so I'll leave it at that. Again, intermittent fasting is just going to kind of accentuate some of those blood sugar handling and ketogenic effects. Again, when we give the body a rest, digesting food is very energy intense. It's not energy efficient. So when we give the body a rest from digesting food, it gives the gut a chance to rest. If we're consuming antigen, inflammatory foods, it gives the gut a chance to rest and repair. Regardless of what we're eating, the gut still needs some time to relax. It's also really interesting that when we have intermittent fasting, it also tones that vagus nerve that I was talking about. So it really has some wonderful benefits that way. And just, again, blood sugar handling, you become, a better fuel burner when you are in a state of intermittent fasting. So if you have brain-based symptoms, considering intermittent fasting, working up to that, don't just go cold turkey, because your body needs to become efficient at changing how it burns fuel. So if you are eating the standard American diet and eating all day long and snacks and having that midnight snack, it could actually be counterproductive for you to just say, okay, I'm going to go, and I'm not going to eat till 2 p.m. tomorrow. You could actually have some adverse effects. So we have blog posts and stuff about how to guide yourself into that intermittent fasting state. I want
to just mention real quick, extended fasts as well. Mm-hmm. Like, talk to your doc before you start doing this, but extended fasts of 4-day, 5-day fasts, water fasts where you're still consuming fluids, there's arguably some incredible benefits that can start to come with that from a brain-based state. And a lot of people say there's no way I couldn't eat for 4 to 5 days. And I'm going to say it's probably not true at all. I've done it. She's done it. And from a brain function standpoint, a lot of people actually talk about their acuity becoming better. And some people even talk about having almost like a high spiritual effect, because their brain is just able to function in a completely different way than it's ever been able to before.
It's difficult to achieve some of that from an intermittent fasting standpoint, but autophagy is really when you go in and you're, again, cleaning up so much debris within the body. And so that kicks in day 2, 3, 4, depending on, how used to fasting your body is. But again, don't do that without the guidance of a clinician, but it can be incredibly therapeutic. And then just real quick, dietary fiber In particular, short-chain fatty acids, and in particular, butyrate. They are all super important compounds for increasing the microbial diversity within the gut, and then therefore, decreasing inflammation in the gut, and then the brain. Again, that gut-brain axis, gut-brain connection, what's happening in the gut is going to have a direct impact on what's happening in the brain. So focusing on good dietary fibers. We have some good supplements for short-chain fatty acids at the office as well. So yeah, those are important things to consider. Vegetable fibers, flaxseed, chia seeds, the list goes on. And then in that, focusing on an anti-inflammatory diet. Again, this is something that we talk about often, but making sure that you're not consuming antigen, which in our world is, foods that are going to cause an inflammatory or an immune response within the body. So gluten is probably the biggest one. Gluten, and closely linked is dairy, but there's many. And for each individual, what is antigenic or inflammatory for you might be different, than another individual. So it's very individualized. Again, work with a practitioner if you're not sure how to troubleshoot that. My book, Restorative Kitchen, has a whole lot more information about that as well. So just making sure that you're eating a clean, anti-inflammatory diet is going to have huge neuroprotective and anti-inflammatory effects. Again, boosting M2 and downregulating M1.
Yeah. Things like DHA, molecular
Yes.
hydrogen, other polyphenols like turmeric or resveratrol, etc., are also fantastic for brain inflammation, brain oxidative stress burdens. But, systemic inflammation is really important too. If you, on blood work, have a high C-reactive protein, for example, that systemic inflammation is able to travel via the vagal nerve up to the brain. And if you've got astrocyte degeneration, which has impacted blood-brain barrier integrity, all of a sudden that systemic inflammatory chemicals are able to cross into the brain and create some of this M1 upregulation within the glial cells and be causing other symptoms. And so all of this can also be impacting the mitochondria of the neurons in the brain. And so if you're sitting here saying, well, I used to be able to read for a long time, and now I feel like I can only read a chapter because after that, my brain is just shutting down. I'm not retaining anything. I can't concentrate on what I'm doing anymore. Or, I used to be able to, drive forever. And now I feel like I drive for 10 minutes and I almost feel fatigued and tired from doing that, from having to focus and concentrate on what I'm doing, where I'm going, what other people are doing around me. That's an endurance problem. It's not necessarily I can't read anymore or I can't drive anymore, but it's I don't have the endurance and the ability to sustain the kind of activity for the duration that I was doing before. That's an ATP production, the energy for the actual cell. And so things to support that are critical too. And I'm just going to, give a plug for low-level laser therapy. We use that in our clinic all the time for different neuroinflammatory conditions where we put a few different lasers. You don't feel anything with it around the brain, and it can have significant impacts on neuroinflammatory changes from everything from autism to Parkinson's to concussions, you name it. I am not saying that you cure autism and Parkinson's from laser. Don't hear me wrong. Don't misquote that anywhere. I'm saying it can be beneficial for helping some of the underlying pathogenesis pathology that is creating some of those conditions and making them so symptomatic. We see all kinds of conditions in the clinic. And a couple of the videos that I'm going to post up, just little brief snippets here on YouTube here at some point this weekend, talk about a condition, pandas and PANS. And, one of these times we should probably do a full video on it. But all of these children that are being diagnosed with autism, many of them have autism, but many of them also have something called PANDAS or PANS, which is an autoimmune encephalopathy. The immune system is attacking the brain and creating massive brain inflammation in these children. I was just on the phone with a father of an 8-year-old today who, this young boy was having all kinds of mood and behavior issues, crazy OCD, massive behavioral change quickly, which is kind of a hallmark. There was a lot of other things that were going on from a behavioral perspective. I was on the phone with Dad, and I first talked with them January, February, and they can't believe how well they almost don't see the problems anymore. But what have we done? We've dealt with pathogens and infections in his brain, and we've decreased neuroinflammation. He's always going to have an autoimmune response to his brain. But guess what we need to do? We need to keep that M2 pathway up, M1 pathway down, and manage that and help to support him for the rest of his life. And that's totally okay. But we need to be aware of what's doing that, because the more of these cells get primed and change, we can't reverse it back. I've got, other patients who are 20-something years old, and I was told, they're autistic, and I listen to them and I'm like, they're not autistic at all. And I run some of these things, and guess what? It's the same thing, and they've been misdiagnosed. Murphy likes to make a cameo every single time. So say hi, Murph. I know. And a lot of these people are being misdiagnosed with autism. And it's not necessarily, it happened in our own family, and it's not autism. It's a lot of times it can be this brain inflammation due to some of these other triggers that we've talked about: pathogens, chemicals, food triggers, mold, Lyme, you name it. So there's a lot to that from a neuroinflammation standpoint. That's kind of a little bit of a deeper dive into what's going on with that. But anxiety and depression, as we talked about in part 1, these are hallmarks of neuroinflammation. They're changes in how the brain functions and feels, largely, oftentimes due to the inflammation that is occurring in the brain. And if we find the inflammatory causes, a lot of times those triggers those symptoms will go away.
I think it's also worth mentioning, those of you that are joining us because you're concerned about anxiety and or depression, the microglia priming is usually a place where we see more significant symptoms. However, we're talking about that because really all of us, but especially if you already are experiencing some sort of brain inflammation, you're just one trauma away from this microglia priming. So it's worth supporting really in all of us, but especially if we have any degree of neuroinflammation. And I just want to make that clear.
Last 2 things, because Dr. Mike, we've totally dominated some of this right now, so I'm sorry. But when it comes to it was just a mild concussion, in my world, there's no concussion that's mild, okay? They all are significant because of these kinds of things. And so often, it's oftentimes talked about that in a clinical setting, it's typically 10 to 15 years behind where the research is actually at. What I'm talking about, what Dr. Ash is talking about, et cetera, this is the latest research coming out of Harvard and some other small schools like that, okay? This is cutting edge stuff. Most clinical practices are not up to speed with that. So mild concussion doesn't exist in my world, okay? And one other interesting thing to note, some of the docs that we've learned all of this from, who are leading researchers in some of this, they have also said that anesthesia is a traumatic brain injury. So every time you have a surgery, that equates to a TBI-like event for the brain. So just something to keep in mind as well. It doesn't have to be the big knock on the head because you were playing hockey. It can be the fact that I've had 16 surgeries for all kinds of things, and that can be a significant onslaught to the brain as well.
Yes, if that's you, find a good functional medicine doctor
to deal with that.
Mm-hmm.
Doc, chime in here from an
Well, no, I'm pretty sure that everybody learned quite a bit from you guys. I mean, it was in depth, but it's interesting, isn't it, that a talk on anxiety and depression plays into so many other neurological disorders, and same way as Dr. Ashley made a comment about sleep. Depression and mood disorders can be a diagnosis as well as a symptom. Same way as sleep. Sleep can be great, and excessive sleep can be a symptom of problems too. And I agree with you, Kevin. I think anybody that is still going back with grade 1 concussion, grade 2 concussion, concussion with loss of consciousness, concussion without loss of consciousness, is living in the Middle Ages in neurologic sciences. So, be careful if that's something that somebody is saying to you, or an athletic trainer at your kid's high school says, "Oh yeah, no, it was only that. He just needs to do an impact study and come back in 2 weeks and do that kind of thing." So that's huge. Well, one of the things Dr. Ashley made a comment, and you guys just made a comment with anesthesia. There's no doubt that anesthetics themselves, because of what they're doing, is suppressing brain function, as well as the hypoxic event, the low oxygen event that occurs. You always see the mask going on and all the other types of things, but you don't realize that there are downtimes in between. Got to wake the person up, stimulate the breathing. Here we go with breathe again too. It's the most basic thing in life as well. But that plays into it from the neurologic standpoint. I'm just going to make a couple of points, because I think one of the things that you guys pointed out is that it is way too complex to generalize. Oh, this will be the right medicine. This will be the right supplement, etc. Each thing has to be individualized, just like every single person is an individual. Every single person's physiology, although there are basics, everybody's physiology is different. And just like Dr. Ashley was talking about, we're always trying to achieve a homeostatic environment, whether that's in the central nervous system, whether that's out in the rest of the body, whether that's in the HPAA axis. And one of the things Ashley started to talk about was stress, and how it has an effect on the autonomic nervous system. But I'll also remind people, because we talked a little bit about this, is how stress has such a big effect on your HPA, or the hypothalamic pituitary adrenal axis, and excess cortisol, how much of a problem that can be inside the body, not only from a standpoint of creating extra insulin production, hyperinsulinemia, and then also altered blood glucose levels, which, as we all know, has a huge effect on the brain as well as on the rest of the body as well, too. Hormones, okay? Let's not forget that hormones are such a big part of how our brain is going to function, but also how the neurotransmitters are going to function. Serotonin and estrogen are known for a long time, because there are serotonin receptors out in the gut as well as in the brain. Okay, so we've got this interconnectivity with everything too. We all probably have heard hypothyroidism has a huge depression correlation between the two. So there are medical diagnoses that we need to, I'll say, exclude before we always kind of pin it on what this depression, what these things are. And like you guys are talking about, there's so many other neurologic conditions that get they are affected by this. I think actually a really cool one, or not cool one, but a scary one, is just like what Dr. Ashley was talking about with the priming, okay, of the microglia. One of the things that we always find in the postmortems in patients with Alzheimer's is something called neurofibrillary tangles. Okay, so those neurofibrillations, those little fibers that the microglia are priming and fixing, are helping to prevent those things from happening. And if we're starting to get more and more disease and more of the M2 priming, then you're going to start to create more of these neurofibrillary tangles and maybe eventually end up with Alzheimer's, not to mention the things you already talked about with MS and the oligodendrocytes and the astrocytes, etc. So maintaining the blood-brain barrier is such an important thing with our general health. Someone might say,
to mention, Doc, real quick on the post-mortem studies, what you said, when we talk about glial priming, you can't see that on an MRI. You cannot visualize glial priming on an MRI. There are some ones that are being used purely for clinical study, for research study that will show that, but we can't, your neurologist cannot order an MRI that's going to show that. There's a couple of units, I think, in the entire country or world that are able to visualize that. The only way you can see glial priming is in post-mortem brain slices. And so just like you're discussing there, that's the only place you can find glial priming. So we can't test and visualize for that. It's clinical presentation and excluding some of the other things like hypothyroidism.
And you're right. SPECT studies, MRI scans, they're not to that point. Technology isn't quite there yet, but we all understand what we need to be doing with that kind of stuff too. I guess the other things like we're talking about, I'm just going to say is not forgetting the other diagnoses that can play into it. Iron deficiency anemia is such a big one too. Iron is what helps to convert tryptophan to serotonin and stuff. So, we need to have that. And that's why a lot of times people that are iron deficient, obviously they're fatigued and stuff, but they also are typically depressed because they're just not making the right amounts of neurotransmitters with the iron deficiency as well. So
and
just the place, it's a plug. What's that?
Pernicious anemia too with B12 for that, as well. Same
so
thing.
All the above. As I said, we could go into depression part 3 and continue to do another hour's worth of study. So as for medications, like I said, they have a role. They have a role for the individual. I think our goal right now is to arm you guys with what you can do in order to help prevent these things from happening. If it gets to the point where we need to use a medication, etc., then that's when you should be talking to us anyway to exclude these other things and to finally kind of say, okay, this is what you need to be doing. Let's try this. Now, remember, medications are not a lifetime event. This is something that it should be typically 6 months to a year to kind of get back. Your body starts to develop what they call tachyphylaxis to those medicines. In other words, your body starts to, and your brain starts to say, hey, I've seen this stuff enough. It's not going to do anything for me anymore. And therefore, you need to start doing other things with it. You probably have seen the commercials a zillion times anymore. There are medicines on the market now that says, oh, I've got depression and I'm taking my medicine, but it isn't quite doing everything I want it to do. So I'm going to take another pill called Rexulti or whatever. There's several of them out there, Abilify, etc., that are meant to potentiate the effect of those antidepressant medications. Let's not go there. I think the problem with those things is as with everything, polypharmacy is not a good answer. There was a question that used to always come up with me is if it's all about brain inflammation, then why can't we just take an anti-inflammatory and be done with it, right? Well, the same thing is true that we talk about with anything. Anti-inflammatories are great. You can take an anti-inflammatory and it would give you some relief of symptoms typically for about 72 hours. But again, your body starts to get used to that. And the other thing is that you're opening the door for so many other side effects from those medications. So let's get to the root causes of what's doing it. Keep the insulin levels down, get your vitamin D levels up. Vitamin D is such a big part of it. Light therapy, like you're saying, laser therapy, obviously, but also your sunlight is what stimulates your brain to start to make serotonin and things too. So there's all those other factors that play into it. So I'm not going to make a big plug for medication. There is definitely a role for it from my perspective, but it's really after we've done all the other things that we should be doing and could be doing to exclude other diagnoses, but also to do healthy lifestyle changes to help maintain brain health in general.
Yeah. You know, other books, you know, if people are interested in other resources, guys like Dr. Dale Bredesen, Dr. Norman Doidge, they've written some fantastic books. The end of Alzheimer's, The Brain That Changes Itself, The Brain That Heals Itself, and they talk about all kinds of things like this. You mentioned light therapy. Well, you know, light is a nutrient too, and it's able to penetrate our brains. I mentioned it with the laser, or penetrate our skulls. I mentioned it with the laser, and you know, in a lot of these asylums back in the day, these patients were not exposed to any light whatsoever, and all of a sudden a nurse will bring a patient out and put them by a window and their entire constitution changes. Well, why? Vitamin D and light is a nutrient. It's critical.
I think it's also worth noting, just talking about serotonin briefly, you know, we can't forget the gut health either. I mentioned it briefly. We were talking about the gut-brain connection, but I think it's 80% of the serotonin in your body is produced in the gut. So, you know, making sure that we're facilitating proper gut health is super important for especially serotonin. And there's going to be blog posts coming. There's a whole post on serotonin, but just felt like our talk wouldn't be complete without, you know, just, you know, neuroinflammation aside, we need to be looking at the gut because it is connected to the brain as well.
There are
and dopamine too, Ashley. I mean, don't forget dopamine, how much produces inside the gut too. So, I mean, both of the two big monoamines that have to do with this. I can't agree with you more. It's such an interesting thing, the gut brain association. And how important the gut is in your immune function. So you can never not talk about that.
Yeah. And for everybody who's curious, there are tests to look at some of this stuff, to look at blood-brain barrier integrity, to look at pathogens that may be impacting the brain. And Dr. Mike, myself, Ash, we all have access to different tests to look at these inflammatory markers, look at pathogens, and get an idea of if we're having immune reactivity in the brain, blood-brain barrier breakdown, as I mentioned, etc. And, you know, frankly, other chemical toxin exposures that might be leading via a vagal function up to the brain that could be creating some of these triggering sort of events as well. So, you know, there are tools to start to look at that. We just can't visualize it on MRIs yet. But
yeah,
what other?
And we use like those.
I use them all the time.
We use them all the time. So,
what other? Any questions that you guys have, or any other closing thoughts that you have, Doc?
I just, you know, this is such a great topic, but it's also such a great area for the collaborative of effort between the three of us, with being able to touch on each one of these things, how to blend the functional medicine and the natural medicine along with the allopathic kind of thing. This is, I'll make a plug for, you know, being able to come in and use this, the laser that you have there, etc., but also to be able to number one, hopefully get people off of medicine, but also be number two, just to be able to help make the proper diagnosis. You made the comment about the 8-year-old. How many times have you heard these stories where people are just kind of pushed under, and it's easier just to throw them into a different diagnostic little group, and then unfortunately they spin their wheels, and they're losing an opportunity where maybe something could have been done. And just like you said, if everything goes into that M2 stage, boy, am I wrong? No, M2 stage, you're done. You're not getting that back again too. So always look at the opportunity to be able to explore other areas.
Yeah, I mean, for that 8-year-old, we caught it right away. And so to see him pretty much back to a full functional state, parents ecstatic in a couple of months is huge. I was mentioning the 20-year-old, 22-year-old, I forget the exact age, where she's been told that they were autistic since they were 5. If you've got 17 years of neuroinflammation that has been completely unchecked because it was written off as autism, we're not seeing nearly as quick of changes. It's not nearly as rapid. It's not likely going to be nearly as complete due to glial priming. And it's sad because unfortunately some of these things we can't change when it has been going on for a long time. So the sooner we can identify, the sooner we can start working, the better the outcome becomes. So any questions that you guys have? It's been quiet, too quiet.
Let me check email.
Just because you did such a good job, you explained everything while you're talking, right?
Is that what it was? I'm making sure no emails came through, but otherwise we're going to sign off here. Keep an eye on your email. We're going to figure out when our next one is and what topic it is, but it'll come out. We'll try to give a little bit more of an advance notice. I know this one was a little bit later. Dr. Ash had put it out on social media, but I know the email didn't go out till today, so I'll try to make sure that we get that scheduled earlier on so it can go into everybody's calendars. But appreciate everybody's time, and we'll look forward to catching up next time since no comments are coming in. Appreciate everybody.
Thanks, guys.